galactosemia. In galactosemia, there is one minor type galactosemia, in which enzyme deficient is galactokinase, and there is oil drop cataract. Okay. The second is classic galactosemia, in which enzyme deficient is GALT. GALT is galactose 1-phosphate uridyl transferase. Okay. This enzyme converts galactose 1-phosphate to UDP galactose. Okay. So that's why uridyl group is getting transferred. So it is uridyl transferase. And here patients have oil drop cataract, jaundice, hepatomegaly, and mental retardation. Okay. Whenever classic word is written for any disease, means that is the most common type of that disease. So if galactosemia written somewhere and it is not mentioned that it is minor or classic, then obviously you consider it is classic type.